Today, our topic is entitled 12 Key Causes of Chest Pain. Normally, chest pain, when people have chest pain, they feel that it is heart attack and they are rushed to the hospital, or sometimes they just take things for granted because it's dull pain. They could go to work with it, but through that, people may have heart attack, and research has shown that even 64% of people that have heart attack, they don't have any symptoms before that, or prior to that. But research has shown that 40% of the population in the world got this chest pain problem, and normally there are several causes, and that's the causes we want to address today for us to understand if these causes are really coming from the heart, or is coming from something else, maybe the lungs, or coming from the stomach due to stomach acid, or coming from the liver, or somewhere. We want to have a look at that. But I want us to have understand a few symptoms why maybe somebody may have a chest pain which may be connected with the heart. Number one situation here, that is symptoms that may be connected with the heart. Normally this symptom is quite mild pain, okay, at the top of your heart on the left side is mild, and it will come and go, and you can go to work with it. But if it comes to heart attack, beloveds, the person may have intense pain, a sort of crushing sort of pain, tightness, and then this tightness can be accompanied with other symptoms like dizziness, lightheadedness, or cold sweat, shortness of breath, racing heartbeat, or the person may feel nauseated, feel like vomiting, and this pain may last for a few minutes, and then it can get worse with activity. All right, so this means that this person is having heart attack. Okay, that can come. But we also have other symptoms that may not be connected with your heart at all. So when you have pain, especially in the middle, the pain that you can massage a little bit or rub, and then the pain subsides or it goes down, and this pain is accompanying like sour taste in your mouth, or you feel like the food that you've eaten is coming back or re-entering the mouth. Medically, it's called regurgitation, right? So when you feel like you have a chest pain and you have a sour taste in the mouth, and you also have a pain that gets better when you change position, it can mean that it's coming from your digestive system. All right, now let's have a look at some 12 key causes of your chest pain. We try to separate them. The first causes are the causes related to your heart. Number one cause which is related to your heart is called angina pain. This means that this is pain, chest pain, caused by poor blood flow to the heart muscles. It means that your arteries, the coronary arteries supplying blood to your heart, is being filled up, so your heart is not receiving, your heart muscles are not receiving enough blood. So this is the real warning that it can lead to heart attack in the future. It's called angina pain. Okay, it comes and go, and then you can feel the pain for a long time. But heart attack is very intensive pain that is due to clot. So there's a complete blockage of blood flow to your heart, and the heart muscles could die, and that is heart attack. Okay, and that is number two. Number three is aortic dissection. Aortic dissection is not common. It's not common at all, but it can happen. What is it? The aorta is the largest artery that takes blood from your heart and supply it to your brain and every organ. So sometimes it can rupture due to certain force between the layers within, but it's not a common cause at all of chest pain. It's not common. And then we have number four, pericarditis. This is the inflammation of the membrane, around your heart, and that can also cause chest pain. Number five is hypertrophic cardiomyopathy. What does it mean? It's thick heart muscles. So when the heart muscles are thickened, it can cause also chest pain. And then we have number 6, mitral valve prolapse. What does it mean here? It means that your heart valve, when you talk about heart valves, we're talking about, well, literally like doors within your heart which direct blood in one way direction. But if these doors or these valves don't close tightly, that can cause chest pain as well. It means that you have a valve disease. And there's another valve problem here. That is aortic stenosis. What does it mean? Your heart valve that is blocked. There's no blood flow, proper blood flow. It cannot open well. So that can also cause chest pain. Now, number 8 onward is not about the heart. Number 8 is the most common cause due to digestive health problem, acid reflux. That is heartburn. That is really common cause. Sometimes people may have swallowing disorders, or they may have gallbladder pancreas problem. It means that it's a tube from the gallbladder that connects your small intestines. There's another tube from your pancreas on the left that connects your small intestine. Sometimes there's a pressure buildup because of sludge, a sort of buildup because your bile production by your liver is not enough. That can cause that. And then number 9 is a muscle bone problem. That is on the rib cage. That could be the cartilage of the rib cage can be inflamed. Sometimes there's a disease called fibromyalgia. That is chronic pain syndrome. It can also cause chest pain, but it's not common. Sometimes some individuals may have injured ribs, and that can cause chest pain. That is very physical thing, so that is not a problem. Then we have lung-related causes. The lung-related causes is number 1 problem is a pulmonary embolism. There may be the embolus, that is a clot that can form and block the artery supplying blood to your lungs. That can cause real chest pain. Okay, and then we have inflammation of the membrane, the covering around your lungs. That can cause chest pain. Medical is called pleurisy. Then the asthma is not common, but can cause chest pain as well. And then your lungs could collapse. That is inflammation between the lung and your chest wall. It's called pneumothorax. Okay, that can also cause severe chest pain, but it's not common. It's not common at all. And then we may have blood pressure that may build up in your lung arteries. That can also cause chest pain. And then we have lung cancer. That is not common at all, but it can happen. And of course, pneumonia. This is lung infection that can also cause chest pain. We have other causes like panic attack and broken heart syndrome, that is extreme stress, especially emotional stress. It means that the broken heart syndrome, somebody might have lost a beloved one. That can lead to severe stress for the heart, and that can cause chest pain. And then we have last one, number 12, is shingles. This is the infection due to nerve infection of virus infection because of reduced immune system. Okay, so today we have understood the 12 key causes of chest pain. If you want to learn more, go to my YouTube channel, put in Dr. James Natural Link. Dr. James Natural Link. When you get there, subscribe. There are a lot of presentations there. Share the presentations, and your life will never be the same. If you want to contact me and share this number, contact me. Calling outside the UK is +44 738 464 7300. If you're calling within the UK, it's 0738 464 7300. When you get there to my YouTube channel, don't forget to subscribe and don't miss any of the future programs. All right. Thank you very, very much for listening to me today.